Hello everybody, my name is Alex Zito, and I'm the host of today's ACA Cast. ACA Cast is the podcast of ACA International, the leading voice of the accounts receivable management industry. Thank you for joining us today. Just a couple of business before we start today's topic about healthcare debt collection. The content presented today is for general references only and should not be used as legal advice. Be at the center of action and hear the latest news from regulators and key lawmakers. Join us at the Washington Insights Fly-In on May 14th to 16th at the Phoenix Park Hotel in Washington, D.C. Registration is now available on our website. According to the most recent ACA International study, healthcare ranks number one in types of debt collected by industry and market shares in 2016. Nearly 47% of debt collected is healthcare related. Joining me in the discussion today is Harry Strausser. Harry is ACA's International Director of Education and Membership Development.
Thanks so much, Alex, and happy to be here. As ACA's Director of Education, I certainly have myself immersed in all types of educational topics from day to day, and I believe one of the more important topics that we discuss as an industry when we think about the membership of ACA surrounds the topic of healthcare and how do we collect on healthcare and what's the culture of healthcare within our organizations. What I'd like to do is introduce everyone to one of our STAR certified instructors. We are happy to have with us today Irene Holheisel. Irene, welcome.
Oh, thank you. I'm really happy that I'm here today. Thanks for asking me.
Well, you're quite welcome, and thanks for agreeing to share some of your ideas on healthcare. As we know that many of our members across ACA collect on a variety of different types of products and a variety of different types of creditor verticals, but we have a great number, if not certainly the overwhelming majority, that are involved in some fashion with healthcare, and that has been your area of expertise in your career within the industry. And as one of our more active certified instructors, I have a couple questions for you about healthcare and healthcare collections and the culture and the best practices. First of all, what I'd like to kind of pick your brain about is, why do you feel healthcare collections is so different than any other type of consumer debt collection that our members might engage in?
Well, that's an easy one for me. First, I do want to give you a forewarning. I love to talk. I have an opinion on everything. So I love that I get to share my opinion on this. And to toot my own horn, I'm pretty good at healthcare collections. So I like to share with everybody. I kind of have this personal feeling like it's my responsibility to change the black eye on our industry. And I feel like if we share our knowledge with our fellow agencies and fellow collectors, that all of us, there's definitely enough debt to go around, but all of us could do a better job and maybe change that perception. The thing about healthcare debt is it's not like we have an extra couple of dollars in our pocket and say, well, you know what, I think I'm going to have my appendix removed. Usually, healthcare debt is created out of necessity, not so much desire. I'm not saying that other bills aren't created out of necessity. Lots of people, they're short on cash, they need food, they'll use a credit card to buy food. But that's more planned. This is something that there's usually a surprise involved, an accident, a sickness, an illness. And with healthcare collections, there's so many other ways to get the bill paid if you have a collector that's really looking for it. We have what we like to call third-party payers. If you have a healthcare collector that's not familiar with that, you're missing out on not only helping the bill get paid for your client, for your agency, but for the consumer too. Because it's nice to be able to find that other way to help the consumer. Because people don't plan well, for the most part, for sicknesses and illness. And to be honest with you, once it happens, even afterward, and now you have this big medical bill, you might still be sick. You might still be injured, so it might affect you going back to work. You might be a person who's paid all their bills your entire life, and suddenly you're faced with this huge medical bill. And what happens, if you haven't planned well or your insurance with the high deductibles we have now doesn't cover it, you have a whole new demographic of the consumer, someone who's not used to owing somebody else money. And suddenly now they're a little older, maybe they're retired, and they owe people money. And now you have to have collectors that could deal with that. I mean, this person is going to be more embarrassed. They're going to feel a little bit more like it's not my fault. And you do have to treat that differently. So I think there's a huge difference between other types of debt and medical debt for that reason. You have a different demographics and you have a different reason, for the most part, for that debt being created.
Sure. No, I completely agree with you. And I think the thing that's happened, and I think anyone listening, we're all consumers ourselves when it comes to healthcare. A lot of folks have healthcare coverage today, but they're rather underinsured from the standpoint that it doesn't cover as much as it used to. And our old $5 copays are now $50 and $75. And it's just tough for people to afford, particularly when you have a family. Now, I think you did a great job of outlining what is core for us to understand about healthcare collections. Now, if we're out looking for individuals to become collectors in our agencies, what do healthcare collectors need to focus on when collecting on accounts? What should they expect if they're going to work in a collection agency that is focused on healthcare? What should they individually be focusing on when attempting to collect and motivate people to pay?
Well, they need to focus on the wants and needs of the client. I know we all do with every type of collections, but think about that medical provider client. They're much more likely to care about how that interaction of what the collector is doing when they're speaking to their patients than maybe some retail debt might be. For instance, medical providers know they're going to have return business, especially if you live in a small town. There's only one hospital, there's only a few doctors. They want that relationship to stay as friendly as possible. Plus, medical industry is really under a microscope. I mean, you see all the different laws that are out there, 501R with charity hospitals. You see all the different ways they're trying to make hospitals accept less money for the same services that they offer. They really are under a microscope. So the last thing they want is to have their image damaged in their communities. And their image could be very easily damaged through what their collection agencies do. So we have a different type of feeling for our clients. A lot of medical provider clients, they'll write off bills for upset patients if they contact them directly just to keep their sanity. Retail clients don't usually do that. You have the product, you bought the widget, you need to pay for it. So it is like that different feeling of you have to understand that client and what their expectations are of you as far as the relationship you have with their patients. It's a lot different. But then we also have conflicting laws. I mean, we have FDCPA and HIPAA. Everybody has FDCPA. And FDCPA is a hard one for all of us, but when you double it with HIPAA that has additional requirements and timelines, and it talks about extraordinary collection actions, that bad word that helps everybody to understand that I don't think the government was always really thinking about the way things are really in real life compared to how nice it looks on paper to try to figure out how to make that hospital run. Those hospitals have an awful lot of restrictions, an awful lot of things they have to do to let their patients know that they have charity programs available to them and restrictions on how much they're allowed to charge and how long they have to accept the application and what we call the ECAs, the Extraordinary Collection Actions, what we're allowed to do and the time frames we're allowed to do it. So they need to be able to really understand that it's not just going to be calling people up and asking for money for a bill they created. There's going to be a lot of explanation of benefits to insurance companies, and they have to learn all that. In my opinion anyway, there's a lot to learn when it comes to medical because of all the variables that change an account or can change an account. And if you have somebody that doesn't have that ability to do it, they're probably going to fail as a medical collector.
Well, I guess, it's not as easy and cut and dry as it used to be, is it? I spent my entire life in collections, and most of which was health care. And it's not the same old bad debt collections that we used to do before. There's so many dynamics. And I would agree with you that the PR aspects, the public relations aspects of our clients in the collections industry, they're very concerned about treating people well, respectfully, offering options and alternatives, and there's a helping hand approach. What traits should an agency look for when hiring someone to collect healthcare debt? We get lots of people that apply for positions. Are you looking for somebody maybe with customer service experience versus someone who's had more of a direct, retail collection experience? What are some of those traits that you think are important?
I'll be honest with you. I very rarely hire somebody that has previous collection experience if it wasn't medical, because they are different. I have to untrain them to train them on how we want done. It's that extra added a job that I have with that. So we try to hire people. Most of the people we hire actually don't even have collection experience. We look for that personality. We look for the people that have those multitasking skills, the ones that are a little bit more of a data seeker, like they're able to read between those lines. You always want to start out the same. I mean, there's some things every collector has to have. You have to make sure that they got the basics. They have to have the ability to talk to people. They have to have the ability to not be afraid of negotiation, but they also have to have intelligence and empathy. They have to have, really important for medical, is a way to think outside the box. Because if you're looking at that account and you're listening to that person talk, you need to be able to pick up those words to look for those deeper pockets, to look for those third-party payers, because they're out there. I mean, it's not just health insurance, Medicare, Medicaid, things like that. You got auto insurance, you got homeowners insurance, you got premises liability, crime victims reparation boards in most states to help people that are victims of a crime, of a violent crime, county liability for those that are incarcerated. You even got from Chapter 13 bankruptcies, you have payments that can come from that. Probate accounts, being able to know when to file a claim and who's responsible and how to get paid. And in rare occasions, if you have pre-collect, you could even do workers' compensation. But if you're not looking for those things and you have a patient, said before, most patients do not have services out of desire. So you have someone that says to you, hey, that happened in my motor vehicle accident, or my insurance should have paid more than that. Your collectors have to be able to understand all these different variables, pull from their knowledge, and explain that explanation of benefits, and explain what happens with the workers' compensation case, or explain what happens if you're in a state that has different types of requirements when it comes on the motor vehicle. Like, for instance, some states have no-fault insurance. Well, that's your primary insurance. Explain to a patient, I need that before even your health insurance is going to pay. If your collectors can't explain what's going on to this person who's going to be pretty novice at it, they've never had to deal with those insurances before, again, we're not doing the best part for our clients, for our company, or for the patients themselves. Looking for somebody who could read between the lines is a big thing.
Sure, and I think you've made it very clear that it's a complicated industry today. And so it's not just an issue of finding a person that we can train to have a customer service-oriented talk off with a consumer and to assist them with their account. There's a wide range of education that's needed to be able to be successful in collections in medical today. Maybe just a real quick comment from you. I think anyone operating in the medical environment has certainly been familiar with the 501R changes that occurred, and you mentioned it briefly. What do you think is probably the most significant change the healthcare collection industry has seen as a result of 501R?
With 501R, I mean, white picket fence world. In a white picket fence world, 501R would actually help us, because if our clients are screening people earlier in the process, that people that truly are eligible for charity, truly people that can't pay, not people that can pay and don't, but people that can't pay, if they're screening them out, we're never getting those people. We're only getting accounts of people that can pay and don't. That actually, in a white picket fence world, would really be helpful. But let's be honest. When a patient walks into a facility and they're having a service, especially if it's in an emergency situation, how is our client supposed to determine if they're going to be eligible under their financial assistance policy in that short period of time? And we all know oftentimes patients don't communicate back with medical providers once they walk out that door. So, sure. Yeah, it makes it very difficult for us. So we wind up having all these people that we have to consider may eventually be eligible for charity. 501R put a whole bunch of dates and timelines in place where suspended collection actions have to stop. I mentioned before the extraordinary collection actions are what affect us the most with 501R, because that's when we would get the accounts, and that would be like legal action and credit reporting. And if you have gotten a judgment, any type of post-judgment remedy like garnishments or hearings, all those things have time frames where they're allowed, but they also have restrictions put in us where not only do they have to be suspended, but if a person makes a payment prior to all this and now they wind up being eligible under the 501R rules, money may have to be refunded to them for payments that they made, where in the past we didn't have that. Normally when a person applied for charity in the past under the financial assistance policies, it was for whatever balance was at the time they were applying. The big thing about 501R, that's not the case anymore. Now you're applying for the episode of care. So if a patient did make payments before they applied for charity, you may have to refund money. I mean, there's so many things. I mean, we could do a whole session on 501R by itself.
You're right, we could. I almost hate to bring it up because you're right. You could talk about it for an entire day. Tell you what, we're out of our time allotted for this program. Ladies and gentlemen listening, I think you'll agree that Irene has an excellent background, an in-depth background in healthcare. She is one of our star certified instructors at ACA. She is frequently presenting our healthcare management program along with a variety of our other programs. So Irene, we thank you for coming and chatting with us today and sharing your expertise. And with that, we'll end today's program and turn it back over to our coordinator, Alex.
Thank you, Harry and Irene. Did you know ACA International offers a monthly newsletter called Pulse, which tailors to healthcare collection professionals and their clients about trends in the healthcare industry. You can subscribe online at acainternational.org. Well, this concludes this episode of ACA Cast. Thank you again for joining us today. You can find ACA Cast on our website or wherever you download and subscribe our podcast.